What are the new treatments for bone TB? Bone tuberculosis, often referred to as bone TB, is a type of extrapulmonary tuberculosis where the bacteria Mycobacterium tuberculosis infects the bones and joints. Treating bone TB primarily involves a long course of antituberculosis medications, similar to those used for pulmonary tuberculosis. However, recent advancements in treatment guidelines and drug development are changing how we approach this condition. One of the most significant updates is the introduction of shorter and more effective drug regimens. The latest tuberculosis treatment guidelines suggest that for drug-sensitive tuberculosis, treatment duration can be reduced from the traditional 6 months to as short as for months 4 in complicated cases. This shorter regimen uses new combinations of medications, making it easier for patients to complete their treatment and lowering the risk of developing drug resistance. While these shorter regimens have mostly been studied in pulmonary tuberculosis, they may also benefit patients with bone TB who have drug-sensitive infections, provided they are under close medical supervision. For those dealing with multidrug-resistant and extensively drug-resistant tuberculosis, the new guidelines recommend all-oral treatment regimens. These replace painful daily injections with safer and more tolerable oral medications, which can significantly improve patient compliance. Newer drugs like bedaquiline and pretomanid are now part of these regimens, leading to faster recovery times and fewer side effects. This is particularly crucial for bone TB patients, where prolonged treatment and drug resistance can complicate recovery. Research is also underway to develop novel drug candidates that target new bacterial pathways. For instance, JNJ-6640 is a promising new drug that inhibits the purine biosynthesis pathway of Mycobacterium tuberculosis, which is vital for its survival. Early studies in animals show that, when used alongside existing tuberculosis medications, it could potentially replace drugs that have higher toxicity. Though still experimental, these new options may enhance treatment for bone TB by shortening therapy durations and reducing side effects. Innovative drug delivery methods are also being explored to improve how medications reach hard-to-access areas like bone tissue. Researchers are investigating advanced delivery systems, such as encapsulating tuberculosis drugs in nanoparticles or using nasal sprays. These methods have been studied for conditions like tuberculous meningitis, aiming to improve drug delivery across barriers. Similar strategies could be adapted for bone TB, potentially increasing drug concentration at the infection site and improving treatment outcomes. Additionally, while not new medications, advancements in imaging, surgical techniques, and supportive care are helping manage the bone damage and deformities caused by bone TB. Early diagnosis combined with optimized drug regimens can reduce the need for extensive surgical interventions. In summary, the new treatments for bone TB reflected broader advancements in tuberculosis care. These include shorter and more effective drug regimens for drug-sensitive cases, all-oral regimens with novel drugs for drug-resistant tuberculosis, and innovative drug candidates and delivery methods currently in development. These advancements aim to improve cure rates, reduce treatment duration, minimize side effects, and tackle drug resistance. However, treating bone TB remains complex and must be personalized. It is crucial for patients to work closely with healthcare professionals to ensure the best possible outcomes. Always consult a healthcare provider for personalized medical advice and adhere strictly to prescribed treatment plans.